The following reenactment is pertinent to a case in which Ezra, a paramedic, recently attended. Ezra invoked an emergency evaluation order on a patient, but felt unsure of his knowledge regarding the law and protocols which should have guided his decision. Upon calling his officer in command to confirm his course of action, it was decided that he should have a refresher on the relevant information which should have guided his actions in this case.
I think it is important for us to first discuss what an emergency examination authority actually is and why it exists. A treatment authority is a lawful authority to provide treatment and care to a person who has a mental illness who does not have capacity to consent to be treated. With this in mind, we need to determine what a mental illness actually entails. The Mental Health Act 2016 defines mental illness as a condition characterized by a clinically significant disturbance of thought, mood, perception, or memory. It should be noted that the presence of a mental illness can occur in conjunction with the aforementioned points. An alternate definition of mental illness is provided by the World Health Organization, which states that mental disorders comprise of a broad range of problems with different symptoms. However, they are generally characterized by some combination of abnormal thoughts, emotions, behaviors, and relationships with others. Examples include schizophrenia, depression, intellectual disabilities, and disorders due to drug abuse. Most of these disorders can be successfully treated. Based on this discussion and the legal definition of a mental illness in Queensland, do you believe that Odessa at the time of your interaction could be identified as suffering from a clinically significant disturbance of thought, mood, perception, or memory?
In accordance with the Mental Health Act 1996, one must present with one or more of the following symptoms to be suffering from a significant disturbance of thought, mood, perception, or memory. At the time of the interaction, I found Odessa to be irrational based upon her decision to refuse transport and persistence to drive post-hypoglycemic episode. However, she did not present with sustained or repeated irrational behavior indicative of the presence of one or more of the above symptoms. Therefore, she did not present with symptoms evident of a significant disturbance of thought, mood, perception, or memory. Regarding signs, the Mental Health Review Tribunal states that an involuntary treatment order may only be used if a person presents with multiple of the following signs. Odessa, at the time of her hypoglycemic event, presented with an altered level of consciousness and inability to concentrate as a direct clinical result of low blood sugar. These signs resolved after administration of glucose, and it was evident that Odessa did not present with any of the above signs. Every adult has the right to make decisions regarding their healthcare, including the decision to reject treatment that is recommended by a healthcare professional. If the patient provides a valid refusal, the paramedic must respect the patient's wishes. As Odessa was 17 at the time of the event, it is questioned as to whether she had the mental capacity and understanding to make a decision to decline further treatment and transport to hospital, as she may not completely or maturely comprehended the seriousness and clinical implications of her hypoglycemic episode. An emergency examination authority authorizes the temporary detention and transport of a patient to a treatment or care facility and doesn't require patient consent. After administration of glucose, Odessa's vital signs returned to normal and there was no significant disturbance of thought, mood, perception, or memory. To detain a person under an EEA, paramedics must believe the patient meets the following criteria. Odessa's mental capacity was impaired and she was at risk of serious harm. However, after appropriate treatment was administered, there was no significant disturbances affecting her mental capacity. Regardless of the improvement in Odessa's condition, she still suffered a serious medical episode which requires ongoing treatment and observation, as it is her best interest and pertinent to her health that she be taken to hospital for further observation in case she does not suffer another episode. An EEA was invoked as she declined any further treatment. In examining the likelihood and capacity of Odessa to harm herself or others, I found it necessary to invoke an EEA to prevent such harm. It was in Odessa's best interest for her liberty to be taken in this instance.
I think it is important to determine the difference between capacity and mental illness. According to the Powers of Attorneys Act 1998, Section 3, capacity exists if a person is capable of A. understanding the nature and effect of decisions about a matter, B. freely and voluntarily making a decision, and C. communicating that decision in some way. It should be noted that this is not relevant whether or not they actually understand, but whether they have the capacity to do so. The level of risk and the significance of the outcome directly correlate to the level of understanding required. Every adult is assumed to have capacity unless it can be proved otherwise. However, Odessa was only 17 at the time of the incident, thus this assumption doesn't apply. Despite being a minor, Odessa can still have the capacity to make a decision. There is no set age at which someone is considered capable of making a decision as it is related to maturity and understanding. The common law does, however, dictate that a young person can make decisions about healthcare if it can be demonstrated that they are sufficiently mature and capable of understanding the consequences of the decision. This is termed Gillick competence and can be determined using the Gillick test. From your interactions, it can be determined that Odessa was old enough and mature enough to have a driver's license, understand that she has a medical condition in type 2 diabetes, independently run errands, and clearly communicate her wishes and reasoning to paramedics. Along with her age of 17, it can be argued that Odessa did possess Gillick competency and thus far had capacity to make relevant decisions. There are, however, conditions that may impair a person's decision-making capacity temporarily or permanently. Therefore, when the paramedics first arrived on scene and Odessa was hypoglycemic, her capacity may have been temporarily impaired. However, once the paramedics administered oral glucose and her condition improved, assuming she returned to a GCS 15, Odessa's mental capacity was fully restored. At the moment of refusing transport, she had full capacity to do so. Capacity is considered independent of mental illness. According to the Mental Health Act 2016, Section 14, a person with a mental illness is presumed to have decision making capacity. The legislation goes on to define a mentally ill person as having capacity if they are able to understand in general terms the following points and is capable of making a decision about the treatment and communicating the decision in some way. Therefore, even if Odessa was found to be mentally ill, this does not subsequently mean that she did not have capacity to refuse transport, which must be determined, as previously mentioned, despite her mental status. It is important to remember that all patients have the right to determine what shall be done with their body and consequently the right to refuse. In these cases, the paramedic has a duty to provide the patient with the full information regarding their condition, recommend treatment, discuss consequences of refusing treatment, and assess the patient to determine that the decision to refuse is valid. The elements of a valid refusal are as listed. Finally, based on everything we have discussed so far, let's determine if it was appropriate for you to evoke an emergency examination authority. One point that I would like to highlight is in Section 13 of the Mental Health Act 2016, where it states that there is a less restrictive way for a person to receive treatment and care if, instead of receiving involuntary treatment and care, the person is able to receive the treatment and care that is reasonably necessary in one of the following ways. Therefore, as Odessa was a minor, a less restrictive way of treating her in the form of transportation to hospital could have been achieved by attempting to contact a parent or guardian and receiving consent from them.